Hello and welcome to the UCL Online MPH. My name is Serena Luchensky and I'm one of the co-directors on the MPH. I'm a clinical associate professor and consultant or specialist in public health as well. In this talk, I'm just going to briefly outline what the vision, values and ethos are for the MPH, what your learning journey will be across the program, what our approach to online learning and teaching are, as well as our approach to assessment on the program. And finally, who our core teaching team is and the key contacts across the program. The vision for the MPH is best explained by the 6 core themes which underpin it. The first is around interdisciplinarity. So many different factors impact health beyond healthcare, beyond population health sciences. So we bring in experts from the built environment, from law, from ecology, and many disciplines to explain their importance and impact on the health of the public. Health inequalities are fundamental to any work in public health. How do we measure them? How do we tackle them? These are some of the issues that we'll try to get to grips with on the MPH. Citizen Voice is all about understanding public health problems from the perspectives of those who are most affected. And how do we co-produce effective solutions with these populations to have a real impact? Practitioner experience is about bringing in people who are working in public health roles in their day-to-day jobs so that you get to understand what it's like from the coalface and how do you actually make decisions in the real world. Core skills is about thinking about the types of things that you're going to need to do as future public health practitioners. So not just about theory and knowledge, but how do we actually apply these using our communication skills, our data analysis skills? How do we reflect on lessons learned and so on? And the final theme is all around implementation, action and impact. So this is not a course that's all about textbook public health. It's about how do we actually do public health to make an impact on the real world. As a new program, we're still defining our values and ethos on the MPH. But some of the core defining features of us are that we try to be very inclusive. We try to take a decolonized approach and not propagate stereotypes. We try to use global examples wherever possible. We try to make things exciting and use innovative approaches to learning and teaching. We're trying to build a strong community of future public health practitioners who are committed to social justice in their future careers. There are 4 main phases to your learning journey on the MPH program. The first is the foundation. It's in term 1, and these are all compulsory or core modules. You've got the fundamentals of interdisciplinary public health, which is a 30 credit module, meaning it's like 2 modules in one. We've also got applied epidemiology and statistics for public health. The expansion phase is in term 2. These are all compulsory modules as well. You've got health improvement theory and practice, health system organization, economics and policy, health protection, and leadership management and communication. In term 3, this is your opportunity for a bit of specialism. So you choose 2 of the 4 optional modules. You've got applied quantitative methods for public health, applied infectious disease epidemiology, qualitative mixed and participatory methods, and urban health. Finally, you have the integration phase of your learning, and this is your dissertation. You begin thinking about it in term 1 of the program and throughout term 2 and 3, and then build more on this over the summer term. I'm not going to tell you too much detail about all of the different modules because you can watch the individual module videos, but this is just showing the broad journey that each of you will go on. For those who are part-time or flexible, obviously the order in which you do these might vary slightly, but we've ensured to only have prerequisites where necessary to ensure maximum flexibility across the program. In terms of our online teaching and learning approach, you'll hear a lot about this, I think, in all of the module introduction videos and so on, and you'll get used to it as you progress on the program. So firstly, we have asynchronous learning materials. So these are materials that you do in your own time. You'll have readings, you'll have videos, discussion forums, all kinds of activities, and they're all available on Moodle. Then you'll have synchronous learning activities, which means that these are things that happen at a set time with your classmates and with your lecturers. And so we have weekly live Zoom sessions to enable you to engage actively and in time with everybody on the program. We use what's called a flipped classroom model, meaning that you complete all of the asynchronous materials before you attend the live Zoom sessions. This is really, really key. So we want to ensure that the discussion that we have in the live sessions is really rich and that people have a knowledge base prior to coming to class. So that, in doing it, this sort of independent learning first and then coming to class means that we'll be able to engage with you and with each other much better. In terms of when you'll get your materials, all of your asynchronous materials are released 2 weeks in advance of the live Zoom session that it relates to. So you have 2 weeks to get through all of the materials to prepare. I'm not going to talk a lot about assessment because all of the other module videos will tell you a little bit more about the individual assessments that they use. But just to say that we've tried to make the assessments as varied and as practice focused as we can across the entire program so that you're developing those skills and doing the types of projects that you actually would in a real life public health job. Just a quick note on terminology in case you're not familiar with it. The summative assessment is your final assessment. That's the thing that you're going to get marked on. You will also hear another term called formative assessments, and these are essentially practice tasks which might mimic certain aspects of the actual marked or summative assessment. And so it's really essential that you do these and you'll get general feedback or maybe a little bit of peer feedback or individual feedback from your tutors on that. And that's going to really help you to ensure that you're successful on the summative assessment. So this slide is just to give you a bit of an overview of the army of people involved in teaching on the MPH. So you've got myself and Dennis Steffler as the co-directors. We've got a student advisor, Rebecca Eaton, who will help you with your well-being needs and support needs. We've got educational or administrative support from Rebecca Payne and Rahima. We've got learning technology support from the faculty in terms of helping to develop all the different materials, learning materials. We've got a fantastic team of core lecturers, so Emma Beard, Masuma Mishu, Aradna Kaushal, and Aisha Amin, and you'll see their faces on lots of different modules throughout the program. And loads of other UCL lecturers who are either module co-leads or just contributing to specific sessions. So there's a huge range of people, and this is not even including all the external speakers and guests, citizens and practitioners and so on. So there are literally hundreds of people helping to deliver the program. So just finally, just a signpost you to a few key contacts and when to contact people. Don't worry, all of this is also on Moodle. Anything to do with your learning materials, content, if you can't attend a live class, do contact your module leads in the first instance. Any administrative problems, we've got a generic admin inbox, and that's monitored by Rebecca Payne and by Rahima. Any sort of personal well-being issues, extenuating circumstances for assessment, so on, our student advisor, Rebecca Eaton, is the best port of call. If you've got tech problems, go to IT support in the first instance if you can't log in, for example. But if it's anything specific about the learning materials, you can either go to the module leads or direct to our learning technologists. So, if the audio isn't working on a video, for example, you could contact either of them to help you. And then finally, there's myself and Dennis, who are very happy to help as the program co-directors. So that's it for me for now, but a very, very warm welcome to the UCL Online MPH, and I look forward to meeting you in Welcome Week. Bye-bye for now.